Hello, everybody, and welcome to Agree to Disagree About Gender. I'm Laura Turgonic,
And I'm Yvette Neri.
and welcome back to our podcast. Today we have on a guest who, when Yvette suggested him to me, I was quite unfamiliar with. And so maybe I'm just going to turn it right over to Yvette to tell us a little bit about who this person is and why we're having him here.
Well, we're going to see J.D. Haltigan today, and I first ran into him at the GenSpect conference last fall, and he did a talk that included identity formation and the impact of social media and how kids are putting together what their sense of self is. And so then I started following him on X, and he has quite strong opinions. He's not shy with what he really thinks. But he has a PhD in developmental psychology and studies psychopathology. So I thought it would be interesting to have a very different point of view than some other folks that we've had on recently.
Yeah, so when I heard a little bit about what his expertise, what his scholarship is in, I think it's interesting, obviously, how people come to understand who they are and what they stand for, and, particularly when we're talking about the gender context, about why they feel strongly aligned or non-aligned to what their body would otherwise tend to dictate, is obviously a very critical issue. We obviously have seen this huge rise of people who are trans, who come to believe or come to understand themselves as trans, or who strongly either believe that they are of another gender or strongly desire to live their lives recognizably as the other gender. I know in the trans community we often ascribe this, to a very simple kind of, well, we live in a better society now. People who wouldn't have come out as early as they do are now feeling free to come out earlier. And that's why we're seeing so many trans people, especially when young. But there were a lot of things, obviously, that didn't totally line up with that theory, as far as why was this preferentially hitting young girls over young boys? Why was it seeming to be happening with young girls who have psychological issues, who are neurodivergent, who've had adverse childhood experiences? So, why
And
was it?
within friend groups.
And within friend groups, why was it tracking certain kinds of pathology as opposed to just being kind of randomly distributed, in the population? If this was something that was if this phenomenon of this rising incidence of trans was completely benign, you'd expect it to follow sort of random distributions of behaviors in the population, but it wasn't. And this obviously requires, I think, a more fulsome explanation. And I recognize there's a lot of different theories floating around about what might be contributing, whether it's social media, whether it's pornography, whether it's, just the changing world. We're living in a more high-stress world where people are more uncertain about their future, where people are, I know we've talked about sort of the role of activists, talking about degendering or the queer issues, and making that available to kids at younger ages or as part of the curriculum. And I think, like a lot of things, these things end up being overdetermined. It's never one thing, and it's often a lot of things working in combination. But like I said, we've theorized about it, and I know as we've talked more, we've come to different conclusions about the relative contributions of different things. But I think it's always good to have an expert in here, even if it's someone who I'm probably inclined to disagree with, based on some of the things I've seen written on them. But that's what the show is about. It's not about having people coming in to glaze us. It's about having people to come in to tell us things that are going to start conversations. And
Right.
so why don't we bring him in and let's get it started.
Let's bring him in. Hi.
Hello.
Hello, good evening. Or good
evening.
morning, or good afternoon. We don't know when people are going to watch this, but good whatever time of the day it is to you. And welcome to the podcast.
Well, thank you for having me.
Yeah. So, as Yvette were saying in the introduction, I wasn't sort of familiar with your work when she had recommended or suggested that we bring you on. And so I'm just going to turn it over to Yvette to maybe ask the first questions and maybe let her introduce you and tell you a little bit about yourself.
Sure. So, thank you for joining us, JD. JD Haltigan holds a PhD in developmental psychology and studies developmental and evolutionary psychopathology. I had a wonderful opportunity to hear you speak last September at the GenSpect conference. And for me, the whole concept of how people form identities and even what today people even call identities, as opposed to even 20, 30 years ago, has struck me as something that isn't spoken to enough. Um, can you give us a basic overview of identity formation in kids and how that might have changed in the past, I don't know, 20, 30 years?
Or maybe even just like someone like me who hasn't really given this as much thought perhaps as Yvette has. Like, what is, when you say identity formation, what are we actually talking about?
Well, when I refer to identity, I'm speaking mostly to Criterion A in the Diagnostic and Statistical Manual of Mental Disorders, which has uh, a new method for assessing personality disorder. And there's two criterion. There's trait disposition, so there's different personality traits. You can be high or low on them. And then there's what's called Criterion A, which is a stable, integrated sense of self, continuity across relationships, in particular, continuity or coherent sense of sexuality and so forth. So Criterion A is really what I'm speaking to about identity. And Yvette, with regards to what's changed, I think so much of what's changed is the idea that we can be anything that we want. And so that idea is instantiated in people's minds, particularly young children's minds in the case of transgender issues. And because of the social media landscape that we're living in, it becomes very much more salient to young children, vulnerable children who may or may not be going through a period in adolescence, which is typically characterized by sort of, uncertainty about who you are as a person, your self-esteem, your development, and so forth. And so this idea that we can be our true, authentic self is sort of, in my view, propaganda that leads to damaging effects, particularly, like I said, for young children and adolescents who are living more or less now, not in the real world, but on social media. And when you don't live in the real world and you live in a world of social media, which is defined by sort of this idea there's limitless possibilities, you're not experiencing the external environment and the natural sort of pushback and stimuli that you would in the natural human relationship environment of the real world. You're not getting the correct sort of feedback to help integrate your sense of self. You're living in a complete fantasy world online. And when I say stability and identity development, that's really what's changed. And you can see then where, in the absence of natural sort of barriers that the external environment provides in terms of social relationships, you can end up with young, vulnerable adolescents, but even not vulnerable adolescents, believing that they can change genders and sexes and basically what it creates is a scenario where identity cannot be coherently integrated across time in a way that is normative. And so we're entering this period of time where the social media landscape is dramatically changing how identity forms, how it's shaped, and its coherency in young children and young adults.
Yeah. So there's a couple of things like there's a lot to sort of to dig. There's a lot of meat on the bone there, in terms of some of the things you said. But I want to go back to one of the first things you said, and I probably should have written this down to get it verbatim, which was that you said that people, and probably more referring to kids, are getting the idea that they can be whoever they want to be. Now, when I hear something like that, I'm sort of like, well, if I go back to the 70s even, when you talked about Marlo Thomas's album and things like Free to Be You and Me, like this is something that probably both of us grew up with it as an influence, and it was sort of the idea was that we shouldn't be limited, that your circumstances or your station shouldn't limit who you are and the kind of person you want to become and the kind of person you want to present yourself in the world. Now, obviously, there's physical, there are some real world constraints that you said, but the idea that we grew up with in the 70s and 80s was that there being a lot of sort of flexibility in terms of defining who you wanted to be. And a lot of this was sort of gendered in the way that if you were a boy, you didn't have to follow sort of a strict code of masculinity. Or if you were a girl, you didn't have to follow a strict code of femininity. Now, is there anything wrong with that?
No, I mean, I grew up in high school with, I went to an all-boys Catholic high school and I was an athlete. I'm sure you can probably tell right off that I'm a highly masculine sort of male, typical, prototypical male. And I went to high school with many males who were more feminine, effeminate. They were in choir or what have you. Many turned out to be, gay.
Sure.
I was taught by gay professors in high school that were male, and so there's no issue that I have with natural variation in levels of masculinity and femininity. That is no problem.
Okay. So what is it that you are really coming in at when you're saying people can't, that that you present this idea that there is some actual constraint, like there is some line that you can cross that falls outside what we would say is normal acceptable variance, because obviously, the rules of culture, the rules of society change over time. There would be a time where someone would have likely been strongly advocating against that type of degree of expression about boys not sticking outside of traditional masculine roles, girls not sticking to traditional feminine roles. And, someone would come in and probably with some amount of compellingness and persuasiveness have made the case of why this is bad for society. Why do you feel that there is a hard limit in terms of how people can express themselves?
Well, the hard limit is defined by biology. I mean, there's just that's the hard limit. You cannot defy biology. So we're talking right now in terms of, sort of personality dispositions, but you can't defy, sex. There's only two sexes. And so that's the hard limit. That's the biological constraint. I mean, my background's in evolutionary psychopathology. So you can't teach a young child that, okay, they may be, a male who is a little bit more softer or effeminate. There's no problem with behaving in that kind of a way, but you can't teach them that they can become a different sex. That's just insane.
Sorry, you look like you're going to say something because your mic was off.
No.
Yeah, so
I was just listening.
Yeah, so I guess when I'm looking at this, when I'm saying it's bad to do a thing as a child, or it's bad to expose a child to a certain set of ideas, is the way I look at it is like, I don't want to put ideas in a child's head that are going to be damaging to that person's ability to flourish, both as a child and adolescent and as an adult. I'm sort of agnostic about what those ideas are, but whatever those ideas are, if I was convinced or compelled to believe that when kids are taught that they can do this or behave in a certain way or believe a certain set of ideas, that it leads to a decreased likelihood that they will flourish as adolescents, however you define flourishing, make friends, do well in school, not be sitting mired in depression and anxiety, be able to function independently as an adult. Anything that potentially interferes with the likelihood of that happening is potentially a bad set of ideas and things we should be guarding against in terms of presenting them as acceptable options for children. Other ideas that might be unusual may not necessarily carry that same valence. So how is it, what is the criteria that we're using to decide? Because I'll agree with you. Like, you can't actually change chromosomes. You can't change gametic potential. Given current technologies and probably future technologies for the time being, that's not something that's in the cards. That being said, here I am. We can argue about the extent that you think I'm flourishing, but I'm doing pretty okay. I got this idea in my head at some point. I decided, obviously, to run with it. It's kind of turned out, and I recognize it doesn't turn out for everybody. But I guess what I'm asking is, what is it about crossing gender or making changes or getting the idea to make changes to your body to make whatever, to give you a better sense of to leave you with a better sense of self, to make you more comfortable in your skin so that you can function better in the world? What is inherently immoral or wrong about that, as opposed to other things that kids could be finding themselves attracted to?
Well, from my perspective, I would say you're teaching someone to live a delusion, and they can flourish in their own delusion. But when we see a psychotic person in their own head, they might be, flourishing in that psychoticism, but we know that is mental illness. Now, in that case, they're not necessarily flourishing in the sense they may be living on the street or what have you, but many people live with delusions that we can recognize. And I think what you're in my view, what you're discussing there is we're teaching a delusion, and that is, in the short term, especially for children, that might work, but in the long run, it's catastrophic, because it's not how the world operates in terms of population level norms, and that's what they have to live in and adjust in. And so I see that as disadvantageous to teach people they can live in their own sort of self world, which is really disconnected from any of the natural social constraints and social conventions that undergird a healthy society that operates according to evolutionary biological principles. So you're teaching, basically, in my view, a heightened delusion state of narcissism, and you end up with just basically psychopathological narcissism. And so, again, that might work in the short term, and somebody could live that way, in their bubble for life, but in the long run, it's not healthy and adaptive. And so you're teaching sort of an individualized way of being rather than an integration into a larger world, which is where everybody functions. And so that doesn't mean that you have to force someone to do things in the larger world that go against what they're free to do. But in this case, what we're talking about is sort of teaching someone to live in a state of delusion, a state of narcissism, in my opinion. And
so, just to be clear, would you say I'm living in a state of delusion right now?
I would say a heightened state of narcissism.
Okay. Well, I just want to put it on the table just so I know that we.
Yeah, no, I appreciate you asking me that question. I mean, delusion implies more like disordered thinking and so forth, but I mean delusion in more of a colloquial sense of.
Like, what you're saying is I chose myself first without giving broader consideration about what impact me doing this is going to have on the larger community and onto others. Would that be fair?
Well, yes, but I think you're even being a little, in my view, there too hard on yourself. I think you're teaching yourself to live in a state of sort of self-infatuation with.
Most people don't use narcissism as a compliment, so I just want to, I'm okay if
I don't mean to suggest that you're sort of rejecting the social world. Obviously, I wouldn't be on this podcast if you did. You would consider me a Nazi and a fascist or whatever.
But I'm very interested in what you have to say. Yeah.
I would say yes. You're living in a heightened state of self-narcissism, which is, if you let that sort of spiral out of control, becomes sort of a state of just self-infatuation that leads to a delusion about your coherent sense of self and who you are. I mean, I don't know your background as to what led you to sort of the realization of why you are the way you are.
Yeah, fair.
But I would say to be frank, I would say that you are, you have a personality, you have elevated personality, mental illness is classified or is sort of discussed in the alternative model of personality disorders. And I don't mean that in a negative way, but just by the criteria of a comparison to normativity.
Yeah. So I can agree with, like, obviously the part that what I've done is unusual. Like, if you want to look at normal curves in terms of what normal human behavior is, let's say for natal males, very few of them, thankfully, end up here. And I say thankfully because I recognize that for me to live like this has been, and one thing I'd probably agree with you on is that there, and I think a lot of trans people don't like hearing this, is that in order for me to find peace with myself, or at least how I came to believe that I needed to find peace with myself, was disruptive. It cost a fair amount of money. It's put real world impositions on the kind of relationships I can choose. Like that's not a doubt. At the same time, I obviously felt that this was a choice that was preferable to continuing to live in the state it was before. Now, the reason I'm giving those contrasts is I think most people would agree, and this isn't just about transness, is that when people find themselves in a state of suffering or in a state of feeling ill at ease, it's natural to look for solutions to that. And you can argue about what those solutions might be in the whether these are non-invasive type of solutions, whether these are wholesale changes that people make to their lives. But the goal, when people do this, even if the goal isn't achieved, the rational thought behind it is I am doing something because I'm finding myself in a state. I have not found other ways to get out of this state. My life span is finite, and I don't necessarily want to live in a state where all evidence to date has shown that this is going to be where it's at and getting worse. This was a choice I made. Now, obviously it was selfish because nobody told me to do this. I decided I was going to do this because this is what I felt I needed to do, and it turned out, at least empirically, that I probably chose correctly. Now I recognize not everybody ends up where I did, but I recognize for myself I chose correctly. But the process behind it was a drive to make my life better. Now, would you blame anybody who feels I'm not with being agnostic to what process they take or what solutions they take? The idea that you are feeling you're in a non-preferred state and want to move to a preferred state, is that intrinsically a narcissistic drive?
No.
Okay.
I was also curious how this process, let's say kids being taught that if you like, I don't know, if girls like sports and boys like Barbie, that they're the other sex and their authentic self is achieved by transition. How is that the same or different from a fully formed adult who has already made, an integrated life, making such a decision?
Are you asking me?
Yeah.
Yeah.
Well, yeah. I mean, I think there's two issues we're discussing right now. One, Laura mentioned, which is the process. That's key. You want to get to a preferred state, and Laura's talking. Okay, is that inherently bad? No, but the process is what's important for an integrated self. I mean, I don't know what leads certain people to determine the process is that they are a different, I guess, sex. Really, is what it comes down to. But the other issue, which you bring up, Yvette, is age. Obviously, Laura, you're an adult, and I would say in your case, you can do what I mean in a free society. I lived in Toronto. I worked at CAMH. Canada's pretty much the same as the U.S. You're free to do what you want as an adult. I would say you're an adult living with personality mental illness. I would. I hope you don't hate me for saying that, but that's how I would view you. For young children, however, you're messing with a developmental stage, and the developmental stage is crucial for them to form that stable, coherent identity. So when you teach them that they can get to a preferred state by, behaving in let's say non-gendered ways, that's I mean, I played with Barbies for a brief time. I had a sister. I mean, but what's happening with gender ideology now is they're teaching children if they feel in a non-gendered way, rather than have sort of a dappling with playing with Barbies or playing dollhouse as a male, you um, you become a different sex, and that is just preposterous.
Yeah. So I want to come back on something because the first thing is something you might be surprised I agree with, which is that you said like I'm living with mental illness, and I can acknowledge that people who are normal don't feel the drive to do what I did. There was obviously some pathology at the root that drove me to adopt a series of decisions that led and a series of behaviors that led to this person you're seeing before you today. And if you want to call that fact that I'm living with mental illness, sure, but I would say that I've had mental illness and I tried to do the best of like, hey, I've got this mental illness, I've got this dysphoria, I've got this persistent desire to be living in a way that is legible with someone who is at the other sex. How do I live with that illness? How can it be treated? How can the symptoms be mitigated? How can I live in a way so that the day-to-day impact of having that mental illness, and this is true of any mental illness, whether I'm talking about depression, whether I'm talking about PTSD, whether I'm talking about a tendency to addiction, it's one thing to recognize you have it, and then the second thing is, well, what do you do about it? Because most mental illnesses cannot be put into complete remittive states permanently. Usually they require chronic care, sometimes medications. But the goal is, for anyone who's living with a mental illness, and I'd say, like, my life would have been better off if I wasn't dysphoric in the first place. Like, that would be, if you want to think of a preferred state, my preferred state would be to be, what could I have done not to have gotten dysphoria? But once I have dysphoria, then the question really is, well, what do I do about it that's going to let me live happily and let me live in a way that I can function in the world and let me live in a way that I can feel at ease with myself? And this is what I chose. Now, I recognize these are, like, just because it worked for me does not mean it's going to work for 100 other people. It may work to various degrees. Some people might do better, some people might do worse. And I think understanding, just like any intervention that you would recommend for a mental illness, you ideally want this to be evidence-based and go by what works, what actually gives that adult who's suffering with dysphoria the best chance to flourish. What I think doesn't work is sort of mental health denial, which is sort of saying, well, you got this, there might be a better choice out there, but I think because you can't change sex, I think choosing this path of interventions is therefore wrong, and therefore I'm going to consign you potentially to suffering. Now, assuming that whatever non-pharmacological interventions are minimally effective. Like the choice, if I didn't do this, and I believe this firmly in my heart, and this is a story that many trans people will tell you, is that if they didn't transition, that they were consigning themselves to this permanent lesser state. Basically, they're consigning themselves to the reality of living with the full impact of an untreated mental illness.
And is there a question in there somewhere?
Well, the question is what you're basically saying is that I've made a moral choice in choosing to treat my mental illness, or that trans people in general are making a moral choice in choosing to treat their mental illness with this set of interventions. Now, that's regardless of whether you believe that I have or have not changed my sex. This is a treatment that was efficacious, and it's a treatment that many other people report as being efficacious. Why? I guess what I'm trying to understand is, why is this felt to be inherently wrong to choose an efficacious intervention for a mental illness that can be quite troublesome?
I would say it's the incorrect process of intervention. You're choosing an intervention that in the short term is relieving you of your dysphoria and your sort of symptomatic expression of sort of this uncomfortableness in a different sex. But you're not dealing with the hard issues of why why you're feeling that way in the first place. You're taking the quickest route to deal with, in my view, whatever is underlying the reason for your feeling that way in the first place. Because dysphoria or discomfort with your own sex is such a rare occurrence in the world that it implies something else is wrong. Now, I don't know your developmental background, of course. There may be pure cases, and when gender dysphoria first was sort of identified, it was mostly males, young males, very, very tiny prevalence.
Yeah.
But in the backgrounds, developmentally speaking, I would say that and I'll just assume in your case, because I don't know your developmental background, I'll assume most people that just sort of, okay, I'm going to take the quick route to change my presentation as a sex, that is not addressing the reason for the incoherence in your way of feeling in the first place. And in most therapies, whether it's depression, particularly for the mood disorders, which dysphoria is kind of that way, it's kind of a pseudo mood situation, there's some underlying background developmentally, in addition to obviously constitutional biological factors that give rise to the sort of presentation. But I mean, we see in a lot of, I shouldn't say a lot of because I don't know, but I know several. I'm sure you're familiar with Brianna Wu.
Yeah, I'm not going to talk about individuals just who aren't on the show.
Right, but I know there's significant developmental trauma in the backgrounds of some of these individuals.
Yeah, I think it's fair to say that among people who transition, that there probably is a higher prevalence of childhood adversity, of other sort of concomitant personality disorders, of adverse childhood experiences, neurodivergence, et cetera. Like, I think that's kind of understood. I guess and you're not wrong in saying that probably something caused this. Like, there is some etiology here. And whether it's a combination of some genetics, some epigenetic influences, some perinatal influences, some early life experiences, some other exposures in the environment that led to, whatever sort of set of inputs that led to me to one day kind of come to this understanding or misunderstanding. Okay, yeah.
Well, there's an important distinction, and that is whether or not the causal factors are predominantly biological and outside your control, or they're environmental. And if they're environmental, in the case of, let's say, developmental trauma in the past, that makes the decision of preferential changing of gender much more a conscious choice to avoid doing the hard work. If you were living with a biological constitutional dysphoria from the get-go that you experienced at a consistent rate throughout your entire childhood, young adulthood, and so forth, and it never alleviated, that would imply that there is nothing else you could really do. There's no developmental trauma to address. There's no background reason. Personality mental illness would suggest that there's some sort of reason for the incoherence of personality function that's outside the realm of just pure deterministic genetic biology. And I think that's what the original gender dysphoria kids were. They just were such a small proportion, a small, tiny rate of people in the population who just had this genetic whatever. I'm suggesting that if you take this preferred mental health route to make yourself in a preferred state, and your background has developmental factors that are non-genetic in origin, which in many cases they are, that's the moral, I wouldn't even call it a moral choice. That's the practical choice that I think is problematic.
Yeah, and I agree with some of what you're saying there, because, like, to go back, it's like there's I guess there's two things. One is like unpacking your past, or unpacking, like, going through sort of that deep psychotherapeutic type of intervention to understand sort of what factors might have led you to come to an understanding of self that maybe is pathologic compared to, might potentially be helpful. But my impression, at least, of sort of psychopathology is like that there are limits. Like you can go through the route. You can do what you call the hard work, and to try to understand your motivations, to try to understand the triggers, to try to understand how you came to be, with the goal of only if you understand how the clock cuts put together, then you can understand how, if you can understand how to take it apart, you can understand how to put it back together again. Like that kind of works well in theory, but do we have a lot of evidence that, whether we're talking about gender, that like this type of psychotherapeutic approach is highly efficacious?
No.
No, we don't. I think it's a good exercise, and the point I'm making is just because you understand, and maybe if I went through the psychotherapeutic process, and I did, before to try to understand like what might have happened in my childhood, how did this come to be, why did I come to believe that, why when I was 6 did I get sort of this idea in my head that life would be better if I was a girl, and why did this stick with me through through adolescence and into early adulthood, and why couldn't I shake it, and why did transition then seem like the best solution for it? Like, I think it's a not unhealthy exercise to go through and try to understand one's sense of self. The question is, at the end, is like, what do you do with that information? If in the end it's kind of, well, you know how you got here, but you're here, then you're really at the same place. Like, you might be in a maybe slightly healthier mental place, but the dysphoria is still going to be there, in all likelihood, at least as a fully formed adult. Now, where I agree with you is I do agree, and Yvette and I talk about this all the time, that there is something going on with the kids. There is something where it's not a primary dysphoria, but it's something that is being, in late childhood or adolescence, where people are young people are grasping onto this idea of, my life is bad. Why is it bad? Oh, maybe it's because I'm the wrong gender. What do I do about that? Well, we've traditionally transitioned people who think they're the wrong gender, so maybe that's your solution. We're learning that this may not be, that, and this may be an understatement, that this may not have been the proper approach to dealing with young people who get this fresh idea in their mind. But it doesn't necessarily mean that the idea is necessarily a bad one, just because, at least to me. So, sorry, that was more rant than question. I want to go back. So I want to go back to the kids, because is there, why do you think this is happening with the kids?
Social media.
Yeah.
And so we're dealing with a taxonomic question here. You're talking about pure gender dysphoria, the original sort of Ken Zucker, Michael Bailey cases that were small, versus this preposterous rise in what's called gender identity. And that's a taxonomic issue, classification issue. And so what's going on with the kids is that they are mood disordered, or not disordered in a sense, but they have elevated mood disturbance, and they're being sort of inculcated to believe the quickest route to alleviate their mood disturbance is to change their gender or present different sex. And that is now coming much more rapidly, with much more intrusive approaches to doing so, not just sort of putting on drag and running around, but actually, for women, cutting off their breasts, or for men, doing crazy things. So it's obviously laid on this is the social media world that we're living in, because it creates a fantasy land of delusion. And by delusion here, I mean, in a colloquial way, this idea that you can do these things, it's going to relieve your suffering, your different sex, but in reality, it doesn't work like that. It does not work like that. And you're talking about a taxonomic issue, in the sense of, you obviously decided to, I guess, transition at a much later point after having lived with this sort of discomfort for some time. You know, that would imply there was some stability in how you were feeling throughout the course of your life. Throughout, I believe you have children and you were married at one point.
I was briefly married. I had, I tried to make it work. It didn't, and we're very briefly married. And but the children who are with me now are with my husband. But the well, I want to come to you before I just, I can talk about me anytime. But before we get, but I think that when we're talking about kids, there's two issues. One is the incidents. Something has happened to drive the incidents, and I think social media is probably as good a theory as anything, as far as like, why has this happened in the last little while, and why is it particularly targeting certain kinds of kids over other kids? The question, the two different questions is, we see rising incidences of a variety of diseases for a variety of different reasons, where we get big spikes of big changes in the epidemiology of diseases, and gender dysphoria is one of those that had a fairly dramatic change in the epidemiology over the last 20 years, which tracks nicely onto sort of the penetration of social media into the environment, particularly the environment of young people. The second part is, okay, we have this increased incidence. What do we do about it? And here's where I believe that clinicians very much got caught flat-footed, in that they were not willing to ask the right questions to try to understand what is driving this incredibly dramatic change in epidemiology, and then ask the question, well, if we're seeing this change in epidemiology, maybe this is a different disease, in a sense. This is something with a different natural history, a different expected response to therapy, a different etiology. I think the gender world was kind of just like, all gender dysphoria is gender dysphoria, it's all good. If you have it, let's just go ahead and treat it, because treating it has seemed to work so well in the past, so why wouldn't it work now? It wasn't, the question was, it was the wrong solution. The reason why the epidemiology changed and what you do about it are kind of two different questions, because there's one world where the etiology goes up because of social media or whatever influences, but transition is the solution still, where it actually makes these kids better. And we'd be like, okay, well, at least these kids are better. The problem we're running into is we're kind of recognizing a lot of cases, and especially in this cohort, where it's clearly not making them any better. It's clearly making them worse. Like, we're seeing the detransitions. We're seeing the people who might not have detransitioned but are clearly struggling. The problem is that our solution isn't the solution that the gender therapists or the gender world were offering as a solution, was not actually providing the benefits that they were purporting it was. If it actually did, I don't know if it would be much of a problem. Like, if we weren't seeing this wave of detransitioners, and if we weren't seeing people struggling with their mental health afterwards, and if we were seeing people actually flourish at high levels, where is obviously apparent, I don't know if this would be as big an issue. The problem is it's not working. And so what is the evidence that we have that other approaches might work better? Like, if you're talking about how do we reintegrate these people, do we have any evidence, or even any speculative evidence, of non-pharmacologic, mental health-focused, behavioral-focused interventions that might be effective at unlocking people out of this dysphoria trap?
Well, you would have to then assess them for mood disturbance to begin with, or personality disturbance, and you would rely on the canonical treatments that have been used for mood disturbance, cognitive behavioral therapy. Those may not be efficacious, but I think you're asking the wrong question and saying, okay, well, what's going to relieve them of their discomfort? That might be the correct treatment. That isn't. What we're seeing is obviously teaching them a delusion. Well, maybe there is none. Maybe it's just they have to wait it out, and there is no treatment that leads to a immediate relief. They have to go through the natural process of development, struggle with these negative feelings, work through them, and become a coherent sense of self in the end. And that might require some monitoring by a professional, but you're again looking for a solution to what is for many a naturally, sort of uncertain period of life, which is the developmental transition to young adulthood. And so the idea that we're going to eliminate negative affect or sadness or discomfort with one's body, I mean, that's kind of absurd. And so I think we're teaching too much of a quick fix for a lot of these issues. And, gender identity disturbance is one that has gone off the rails for, for reasons that have more to do. I mean, obviously people are self-medicate all the time now for things like depression, anxiety. It's out of control. Yeah. But with gender, you're dealing with a much more deeper, a deeper sort of incoherent way to address discomfort than you are with just putting someone on sort of a SSRI for depression. Yeah. You're suggesting they can become in their head a different sex. They can actually change their body to achieve that. And so what is the correct treatment to avoid what you're saying you're seeing with the obvious implications of teaching children a delusion? Well, it may just be the regular canonical treatments that either A, offer not much relief, as you know, and we've just discussed, or just they have to push through. Yeah. And in the end, you become a coherent person because of that.
So like what I'm hearing is that there's value to suffering.
Yes.
Okay. Which is sort of classic Christian teaching. If in a lot of ways, this isn't a new concept that tribulations. Putting ourselves in difficult situations or having to suffer through difficult times builds character, or which makes one a stronger.
I would call it developmental struggle as opposed to suffering. I mean, obviously, if you're bleeding out and you're in chronic pain, and it's biologically based chronic pain, and you can get a broken ankle fixed, that's different than the psychological realm, which is what we're discussing.
Yeah, fair. I recognize that psychological diseases are important and impactful, but they're more challenging to identify. We have challenges figuring out exactly what the lesion is, as opposed to biological illnesses. But suffering can still be suffering, and mental suffering can be quite profound, even without necessarily a biologic. An obvious biologic correlate or an objective test that you can do to demonstrate or quantify the amount of suffering. And like I said, I can agree to a point that there's sometimes some value in struggle and value in suffering, and taking the easy way versus the hard way is not. Sometimes there is value in, this is something we teach our kids all the time, that, it's like, with the classic teaching, you can do it easy now or harder later, or you can put the time in now and then you're like, it's easy later. This is classic, this isn't something that needs to be explained to people, but at the same time, if there were an efficacious solution that was easy, it's often preferable to the one that's hard. We see this right now in the world of weight loss. You can diet and exercise and be really regimented on your diet and on your eating habits and on your exercise, and maybe you'll lose some weight. Maybe 5% of the time you will, or that's a hard way, or you can take a needle once a week, the easy way, which seems so far to be a pretty sweet deal. Now I recognize that we're early in the game with GLP-1s. We might learn of some side effects later, but right now it seems like, why do we make people suffer? Like, why do we give people dietary advice that is only efficacious in 5% of people, when you can give someone a GLP-1 and they'll thank you within a week?
Well, and
this is philosophical, I guess, but
yes, but we're in the realm of philosophy, so you're talking really about character. I mean, I'm a very regimented dieter. I can attest to exactly what you're saying. It's difficult. I go to the gym. I'm very regimented. I track my meals. I'm well aware of the GLP-1 research. I'm almost certain there will be side effects. But you're asking, okay, yeah, it's much easier especially for women who are concerned about their appearance, to just pop a needle and not have to do the hard work. I mean, I see, like tonight, I'm going to go to the gym. I'll see women in there struggling on the treadmill to
Yeah.
get it down, and they could easily pop a GLP-1, but I think there's value in their struggle to build character, and we're talking about personality is character.
Sure.
And so if we're talking about a disorder or a condition of personality, we're talking about character issues in the sense of what is a normal, what is a healthy character versus what is a character who has, less robustness or less coherency.
Yeah.
And I think this is getting to the core philosophical issue, because there's a lot of detractors for Criterion A who will say that Criterion A is too much of a psychodynamic formulation of a healthy character, a healthy personality functioning. But we have to have an anchor to orient around to determine what we consider a healthy personality or a strong character. And the more something deviates from that statistically, plus 1, 2, 3, 4 standard deviations out, and I would say you're, well out there, 3 standard deviations. Now, what's fortunate for you is that you did this later. And so I have no issue if you want to live your life in any way you want. But for young children, it's way different, because they're making choices they have no sense of certainty about, based on propaganda and lies fed to them in a social media environment where there is no contact with external reality.
Yeah.
If you lived in social media all day long, you could just say, okay, I'm going to go get a GLP-1 needle, pop it, pop it, pop it. But if you exist in the real world as a male or a female needle, and you went to school, you got bullied if you were overweight. You got bullied if you were, you had a deformity or whatever. That's the natural process of development that occurs, where you learn to address, live with that. I know certainly the feedback I got, I improved my athleticism, but I was certainly bullied for being, I wouldn't say bullied, but you get the sort of cat calls or whatever for being
but you seem to be
different.
suggesting that, like, not that, we live in sort of a no bullying culture right now, that
Right. No struggle. Just fix it. Everybody's included. Inclusivity everywhere. That the world doesn't work like that. It just does not. And teaching children the delusion that it does is foolhardy, in my opinion.
Teaching kids in a school, like, where there's like a no bullying policy, doesn't protect them for the real world, where bullies are actually out there and they have to learn how to deal with them. Is this?
Yeah.
So
inclusivity and belonging have been disastrous for character development.
Yeah, like I know as we come up on time, that's a sort of a whole different conversation. I was on, yeah, but
I think it's related to the philosophical issues that you're bringing up around gender, and
yeah,
again, it's a larger discussion.
Like I said, where I agree with you is, like, yeah, we shouldn't tell kids that they can actually change their gender. Like, we shouldn't tell adults that either. I mean, that they can actually change their sex in the sense of, but it's not a delusion to believe that you can do things that will change enough about you and will allow you to do things in the world and be legible in a way that people will interpret you as being the other sex, like that. Like, that's my daily life. Now, you can say it's wrong that I'm doing that, but it's not a delusion to believe that this actually can work. Now, as we've been talking about the last 45 minutes, is in terms of, is this the best solution to the problem, or are there other solutions that might have led me to even a more richer and fuller life than I'm currently living, or on average would lead a trans person to live a more fuller and flourishing life than they are currently living? Perhaps. But I'm not, like, I'm saying, like, I'm not living under any delusions that I'm anything that I'm not. I just know that.
No, and I would say that speaks to a sense, at least in a certain aspect of coherency to your personality that leads me to believe that in some ways, and that there is something a little awry. Like, you have a level of self-awareness that is almost that almost belies your current presentation, and so it's kind of wild to sort of see that you it's almost like something's amiss,
Well, like, of course,
about.
I'm not dishonest to say that if I'd never developed dysphoria and I went through my whole life, and maybe I'd be sitting sort of giving a talk like you are, right now, as someone who was born male and never got, or never got dysphoria, or had very transient dysphoria that wore off, and I would be, maybe on some podcast talking about how I conquered it, or how whatever the skill set I had, like that could have been a life outcome for me. It wasn't, obviously, and I recognize that, as I said earlier in the podcast, that I had a pathology. Like, this was something that it would have been preferential not to have, and I dealt with it in the best way I knew how, and I've done pretty good with it. I one of the things I think, because we talk about social media, is that we probably all spend too much time on social media too, and
Oh, no doubt.
and one of the things when you spend time on social media is you do not probably see the true cross section of trans people living in the world. I'm there purposefully. I wasn't there for a long time. Many of the people who are doing well is probably inversely correlated with the amount of time you spend on social media, and you're just less likely to come across them in your day-to-day. I hope I'm not that shocking to you, because I know lots of people like me. Not necessarily because I met them through social media, but people I met through having transitioned around the same time I do, who are working in all walks of lives, other physicians, lawyers, teachers, professors, people in the military, people who are doing whatever job you can think of. We're out there. If you just look at internet transsexuals, we're a pretty odd bunch. So I wish we lived in a world where you seeing me wasn't quite so much of a shock to the senses.
Well, I wouldn't say it's a shock to my senses at all. I would just say that it illustrates to me the psychopathology in real life. I mean,
Yeah.
it's not a shock to see your presentation. I mean, you have all the sort of stereotypical presentation of a trans adult. I mean, the mannerisms that you're displaying right now on our podcast are characteristic of that sort of stereotype of a trans woman. And so it doesn't shock me.
So what's aside the fact that we're sitting here talking trans stuff all day? Just out of curiosity, what are you observing that is so trans?
Well, just like you're playing with your hair, and you're constantly sort of in this heightened state of self-awareness about your body. So I mean, it's kind of like the present. You're giving away the game in the sense of the sort of brittleness of the affect. And so I mean, it doesn't shock me in that sense, but I think it's almost a presentation of the pathology that you're trying to preferentially address by being a woman.
Like I'd say it's my ADHD, but sure.
Well, and then I mean, okay, I didn't know you had or were diagnosed with ADHD, but you're starting to give me the even more stereotypical presentation of this high comorbidity of all kinds of disorders.
I have ADHD like many people do, but I'm not saying it's not a pathology, but yeah, no, I have it, and it makes me very active with my hands. But
when you combine that and you correlate it with everything else, it becomes a different picture. I mean, I do work on the general factor of psychopathology all the time, so
sure.
I know like ADHD is we're talking disorder wise categorically, but all these characteristics and symptoms correlate. And you can give rise to a general psychopathology factor, which is called the P factor. I'm sure you're probably aware of that literature. So, I mean, it's again a larger discussion, but you're kind of you're not rare for me to see, and I mean, you're the stereotypical presentation of a trans female. If I saw you in the gym, I would know right away.
Because I'd be playing with my hair.
No, because I mean, it's not just playing with your hair, but you're nervous. You're
Well,
sort of
I'll admit to being nervous because we're having a pretty intense conversation about something I feel pretty deeply
yes,
about, and
yes.
I want to make sure I get it right.
There's no
But
getting it right.
well,
We're there's no.
no. We're this is going to be for posterity, and I don't want to say something silly or something that is
But even that, I mean, you can't. I mean, we're all coming to this discussion in good faith. So I mean,
sure.
just even the nervousness about saying something silly. I mean, you could say something silly at any point during the day. I mean, it's just there's a reality.
Yeah, yeah. But most of the silly stuff I say during the day doesn't get broadcast to, several hundred, perhaps several thousand people. So yeah, it does make a difference.
Well, but yeah, but you know that if you say something silly, what you're implying there is that because it's broadcast to your channel, and I see this, I have a very large following on X. I mean,
Yeah,
so people will call you out and make fun of you, perhaps, or say that you're delusional, or criticize you, and that's part
that's
of
being a
the
trans woman on
external
the
world.
internet these days. Yeah.
Well, that's part of the sort of external world that's important for people to deal with. I mean, I've been called all kinds of things on X and Twitter. I know that I speak and I'll say things that are silly every time I do a podcast, but that's part of healthy development, learning how to metabolize that sort of affect without quickly saying you don't want to exist in that world. I mean, shutting off from that is, I mean, there's a certain level where you have to shut off and you can't go crazy, but to sort of live in a bubble where you don't want to expose yourself to any negative affect to metabolize is, in my view, part of the problem we're discussing now.
In fact, you've been quiet. I know you've been
Well,
enjoying.
well, y'all have been having a great conversation, and I didn't have a specific question on the same topic.
Okay.
Well, I mean,
So
it's a challenge for me to have the discussion. I mean, as well. So I appreciate the invite, but as I was saying to Yvette when we first decided I would come on, is like I had no idea who you were. I mean, I knew Yvette had mentioned she met me in Albuquerque, which was the conference where most people kind of see the same thing. But
yeah,
and then I looked up you, and I was like, I saw your bio, and you're at the University of Toronto, where I was for a bit in the Department of Psychiatry, and I was like, I mean, I immediately had some, feelings. And so it's challenging to come in and discuss what I see as clear personality mental illness with somebody who I can value your perspective of, look, I feel this way. I don't want to live in this state of negative affect. So I can resonate with you saying you don't want to be like that. But what I do see is, okay, you're at the University of Toronto, you have a rainbow lab or something in gastro and whatever your specialty is. That
gastroenterology.
seems a little crazy to me. Like, it's like, and
It,
so I don't know how to even metabolize my own affect
it seems
around.
crazy that I practice gastroenterology, or it seems crazy
Well,
that
not that you practice
it's a
gastroenterology,
pretty crazy field, but
yeah, it's a very specialized field. My
yeah.
sister's a medical doctor too. She's just a general, practitioner. But like a rainbow lab to me just is like
Sorry,
I have to process.
what's a rainbow lab?
I thought I saw on your signature a rainbow lab or some
Oh no,
affiliation.
it's an advocacy group for GLBT physicians and patients.
Yeah,
I
and
don't.
so okay, like that strikes me as like right away is like discordant. I mean, so you're physicians and you're advocating now. LGB is one thing, TQ plus is another, and so as a
Well,
physician,
we're advocating because we see patients who are LGB and T and Q. These
but
patients
I would
exist.
say that there's no.
They come into our practice, and we want to make sure that, as for any patient of any identity or any background, that we're giving them culturally competent care that we think serves their best interests. I'm not someone who's involved in actively practicing gender medicine. I don't prescribe hormones or things of that nature, but I see patients on hormones, and it's important for me to understand if someone's on hormones, what kind of gastrointestinal issues might they run into. And it's important for patients to understand who might be on hormones, what kind of problems they might run into, and when they might need to see someone like me. And it's important for physicians who see people who might be trans to know what is that? What are some respectful ways of making sure that they feel comfortable in the healthcare system? I think these are
And I
important
think
things.
that's what's hard for me to sort of metabolize. I don't think trans is a real phenomenon. I think it's a personality mental illness. So you have to then you have to
Well,
refer them
what
to the
if even
quote.
if you want to think of it as that, these people are still going to come to my clinic with
Yes,
with floating,
yes,
um,
100%.
and whether I think it's a real thing that should be valued or whether I think it's all bullshit. I still want, these are still patients in my office, and I still want to provide them with the best possible care, and I think that's an important
Yes,
thing to do.
and I would say the best possible care is to refer them to mental health.
Well, they're probably already seeing mental health if they're seeing me. Like
Well, and there's the
they're seeing me
clue.
because they have Crohn's disease.
There's yes, and so yeah, I have no problem with you treating the Crohn's, just independent of what they're dealing with their own psychiatrist. Absolutely, but I think the problem we run into is when you have TQ plus as sort of a medical provider, and I'm not saying your specialty does this, but if you start providing puberty blockers, then you create
Right, like
problems
that's a whole different thing. But like what I'm talking about is that like I care about the well-being of my patients. Many of my patients come from that background. Because I've come from that background, I have some experience and understanding of what it's like to be a patient in that situation. And I want to make sure that my colleagues are treating patients who are in my situation in a respectful way. I think that's a laudable goal. I think that's as far as I'm going to defend it, but I think it's a
right. And
laudable
I think
goal.
a respectable way is obviously if they have Crohn's disease, you treat that per protocol as how you would treat Crohn's disease for any other person that's not trans or not queer. But the problem is when you accept a delusion and you modify treatment, and I'm not saying your specialty does this in any way, but there are specialties like endocrine specialties that will modify the way they treat young children. They'll put them on puberty blockers to alleviate that. That's problematic in my view. So when
Yeah,
you
like I'd
mix
say it's problematic. It's
medicine,
problematic in as far as we don't know how. If it was efficacious, it would be less problematic, and if it was not efficacious, it would be completely
well, I
problematic.
think you're
Yeah,
starting from the wrong. I mean, to
yeah,
even think that it would be efficacious is sort of, in my view, absurd. I mean, we're dealing with something in the case of TQ plus that is much different than LGB, and that distinction has been completely blurred. And so that's where I come down on this issue. And I think obviously again to sort of wrap up is that
yeah.
you're an adult. I mean, so I see less of a problem, but Jen Speck, the current situations that we're talking about have mostly to do with adolescents, and so that's really where the danger is. And I don't see you out there advocating that everything that they're doing with adolescents is correct. In fact, I see you suggesting that you need caution, which I think is a good thing.
Yeah, yeah.
Um,
Like probably not as much caution as many as a vet would say, but or as many on the general critical side. But I do think clinicians have made some very serious errors in judgment, and serious errors in being subject to influence, to being over reliant on the influence of activists that led them that blinded
yeah,
them to asking the questions they were supposed to be asking.
and again, I think that
Because I look at
tracks,
this as an efficacy question, not as a moral question. I look at it purely as an efficacy question.
and I think that tracks again with what I mentioned about there is a stability of a coherency to your personality that is otherwise not apparent in many, even adults who profess
Yeah.
that they're transgender or what have you.
All right. I know you said you had to get going, and we have been going for just over an hour, so I want to thank you for your generosity of your time because I know you said you're on schedule today. Very engaging conversation. Thank you for putting up with it. Because I know it's a lot of times, one of the things that we talk about is we talk about things that I know we feel very strongly about. And emotions can run high, and one of the things we try to make sure we do is try to stay, even when we disagree and disagree vigorously, that we kind of stay on track. And I think we did that today. So thank you for being part of this with us.
My pleasure, and again,
Yeah.
I think I exactly agree with what you just said.
All right. Have a
Thank
great
you
day.
so much for joining us.
Bye bye.
Bye bye.
Bye bye.
Take care.
But he's knowledgeable. He's an academic. He's professional. He's well read. He's not just talking on. He's not just a Twitter nobody spouting off nonsense because he's heard someone else spout off the same nonsense.
Right. I was interested in like the phenomenon of the normalization of mental illness, which
Hmm,
then many youth adopt and create an identity out of.
that is interesting.
Yeah,
Like,
that kind of thing. And he has also written and spoken about um, suicidality in gender distressed youth and how those numbers are they that generally what we see is correlation with other mental health issues and other adverse childhood events. And
yeah,
that if you control for those things, just the gender distress is not does not increase suicide.
yeah. Like, I think there's some truth there. Like in the sense that, like, this whole idea of people adopting identities, like even before gender identities were a big deal. People in high school who were troubled in various ways. They came from bad families. They were, whatever, just psychologically complex kids. Were the types of kids who would tend to glom on to alternate identities. And sometimes it would be things like if you were an emo, or if you ended up being a hard rocker, or even if you went like really religious, like there were
Right.
certain of things that people did to that were non-criminal, but were clearly an attempt to kind of be like, I know I've come from this crazy place. I'm kind of a fuck up. How do I define myself? How do I redefine myself in a new role where I'm not a fuck up, in a sense, where
Right,
I have a
right.
community of
And I
people? Yeah,
yeah, I would say those things are more pro-social because then all the emo kids would be hanging out with each other and
yeah,
they ultimately outgrow it when they don't need that anymore. Um, when I was young too, and you too, kids gathered and connected with each other around music and
yeah,
what bands they liked. But JD has a great point when kids are going online and they're participating in this completely a fantasy world where people are presenting themselves as anime avatars and this yeah it's I don't think it's pro-social. I
yeah.
think a lot of it
Like
is,
I know a lot of it's strange. Like there's no doubt about that. Like I don't have any
but it doesn't
relationship.
help them connect in person
Yeah,
with other people
yeah. Like
because
I
we're
guess
social animals.
yeah, we are social animals, and especially for those of us who didn't grow up in the internet age, and we
Mm-hmm.
see this now, especially as like COVID restrictions, like people are really craving in-person experiences from our generation, and
Mm-hmm.
yeah, and maybe, but like when I look at my kids, like my kids obviously are online a lot more than I would have been because we didn't have it. They're online more than I'd like them to be honest. Um, but they're social in they're like differently social. Like what they do online is social. I think there's ways you can be antisocial online, and there's ways you can be social. Like it's basically their friends from school connecting and playing games together online. And sometimes those kids will come over to the house and they'll all play in front of the TV online. Like,
Okay, now that's different
yeah, but
because then
sometimes,
it's also in person.
yeah, and
Um,
sometimes they'll play remotely because it's just more convenient if they're all sitting at their homes to play remotely at 10 o'clock at night than I'll go to someone's house. But I'm saying like even social media, I think because there are ways to be antisocial on it, and there are ways to be pro-social on it, that the kind of kids who tend to choose the more antisocial routes are the ones that get into trouble. But even with something like anime, and like I said, this isn't my world, so I might be misdescribing it. And if we have any sort of
right.
people in this world who are watching, they can probably correct me. But like, I know there's a lot of people who are naturally not wired to be very social, who find comfort in this world where they don't have to worry about the bully, and they don't have to worry about what is people going to think of me. Everybody on the internet is a dog, uh, kind of scenario where this brings them some comfort. But then those people also often make real life connections on this. So people go to like these anime festivals or what, or whatever they're called, like this Comic Con or those types of things. And it becomes sort of this. They build a community through that. Now it might be slightly insulated from the real world, but it still is. There's some pro-social elements to it. Like I said, there's a lot that JD said that just was not. It didn't speak to me. It might have spoken to other
Sure.
people, but it just didn't speak to me as far as, you know, am I living in a delusion? That type of thing. But what I did get the sense of is that this is moral when it comes down to it at the end of the day. And the reason I often go back to efficacy language is because I try to rob it of the moral judgment. Like, it's bad to do this or it's good to do this. Like, for me, it's bad to transition genders if it's unhealthy. It's not
right, but efficacious to what?
like,
Yeah, things have results, but
well, what I mean is, like, it actually makes you have a life that's worth living, and that on top of that, as a bonus, if you can actually thrive, if you can actually if you can actually like have a good job, have form relationships with other people, contribute to your
Right.
community. If you can do all those things, that's even better. But the way I frame it as an efficacy question, even though like we can have different definitions, what efficacy is I'm trying to decouple it from any moral judgment, which is that if transitioning makes your life worse, then it's bad. If translation makes your life better, then it's good. And we should try to do more good things than bad things. And if something is good for
Sure.
someone, as opposed to it is bad to change genders because there is God made man and woman, if you want to put it on a religious framing, or biologically evolutionary, we're a gonorrhic species that has two distinct genders, and that's just the way it is, and you're gonna have to tough it out.
Or we have two sexes.
Or I mean,
Like
sorry,
gender's anything.
Fine. We have two sexes. We have two sexes, and that's just the way it is because that's what biology and evolution have determined for our species. Like, that's a moral, and transcending it is crossing a line that we shouldn't cross.
I think y'all are. I didn't see his point of view on that as a moral one, because you and he are defining harm differently.
Sure, but I still, like, what I was trying to work him towards is at least, and whichever we answered is fair. Of like, if there was, I recognize transitions are invasive and consequential and all that. If there was some really, let's say we could cure dysphoria by opening your skull and taking out a small piece of your brain. And I say that just as obviously I want something that's gory, something that
right.
something that is, you wouldn't just run into and say, yeah, I want to do this. Something that might have complications or side effects, but something
right, and some percentage of the time they're going to hit a nerve.
You're going to nick something,
or you're going to nick something that causes that person to lose
have
function,
a stroke or whatever. But if it reliably cured dysphoria, would someone like JD recommend it? Like, if I could identify a spot in your brain, the gender gremlin spot in your brain that was sort of gremlining out, if you could identify it, and it was an efficacious therapy, but it was invasive, it was gory, we've got to drill a hole in your head and we've got to carve out this thing, it's going to change who you are because we're removing a piece of your brain, would you be for it if it actually got rid of dysphoria? Now,
I think, well, that might be, I don't, maybe more up to the person, is taking this risk worth it to end my suffering?
Well, that's where we're at. That's why that's an efficacy question. Now, someone might say it's immoral. The point I'm making is that I would suspect that someone like JD would say if it worked, they would do it because that doesn't involve crossing gender lines, which I believe he's drawn a moral line around. But he'd be okay with drilling a hole in your skull to do it if it was efficacious. Whereas, and I think it's an important difference because, and I said this is perception, and people can say what they want, but perceptions do matter, and my perceptions are obviously framed by my life experience. But I was feeling a lot of moral judgment, not just of me per se, but moral judgment of this idea that because you cannot actually change sex, you should not change any aspects of your life that would give someone the impression that you've changed sex. That's a moral question.
Maybe,
Yeah.
maybe.
Yeah, we can think on like
Right. Yeah, and there are so many extensions of that we didn't really have an opportunity
yeah,
to get into,
yeah.
because
But,
you know, one can change one's presentation, but then if you know, then we don't have people born male playing in women's sports.
yeah, like
You know,
I
is
think
that beneficial?
those are secondary issues. Like those are like just like
But
like I'm saying,
they're pointing to the same kind of thing, because the assumption is when natal males are playing in women's sports that they've actually changed sex enough to be appropriate in the women's
yeah.
division.
But I still think that's a different question than have you changed sex? Like you know, when it comes to like being in women's circles, not in sports, is that I'm generally welcomed into them because of some combination of factors that makes me the kind of person that feels like they should be welcoming, as opposed to some trans people, which would probably be very different. And not that they're bad people, just that you know.
Sure.
But and I've done this all without changing a gamete and without changing a chromosome. The the other thing is that I actually kind of admired in him is he stuck to his guns. Like he was not afraid to tell me I had pathology. Like you know, one of the you know, like I think a lot of people are internet warriors and in life and real life cowards, and he definitely wasn't a coward. Like he had his point of views and he shared them. He told me he he thought I would be a trans woman, and he you know I don't know you know like I'm not going to get into like why he thought that. Obviously, it's easier to tell when you've told someone before, but you know obviously. You know, like the playing with the hair and the things like that, which are ADHD things, but ADHD certainly does track onto transness to some degree. You know, like guilty as charged. But you know, he wasn't shy about like trying to tell me things just to make me feel good. Which, on one hand, like I said, it's hard to hear, but on the other hand, I appreciate people who are direct and honest. Like.
Right. And he did not say anything in a mean-spirited way.
No, he was just kind
he
of
was
like,
just like, this for me, this is the deal.
Yeah.
This is my understanding. This is how I see it.
Yeah. But I don't know. I thought it was, you know, I thought it was a really interesting conversation. Like it's definitely a conversation I would have liked to be listening to, or I hope reviewers enjoyed as much as I enjoyed being part of it. But it was a good debate in a sense.
Yeah, no, and it was interesting to hear his particular point of view, just because we haven't heard anyone's point of view like it.
No,
on here.
Much more like you know. I recognize. I'm not saying the guests have to come on here and tell me nice things all the time. But he was definitely the person who I think was the most assertive in his arguments and didn't try to like sort of sugarcoat them for the audience. You know, that's appreciated.
Sure.
Yeah. Anything else about JD?
No, I think that's it.
All right. So we'll see you all next time.
Okay.
All right.
Bye-bye.
Okay.